Thank you, Madam Speaker. And I hope what I'm getting ready to say turns out to be redundant, that we're going to hear it in the closings of both the gentlelady from Florida and the gentleman from Texas. We talk about this pre-existing conditions bill today as if it's going to help with pre-existing conditions. As we've discussed already, it's not. But the pre-existing conditions issue is a very real issue. It's a very real issue for families all across the country. It has been for a long time. And undeniably, elections were won and lost this past cycle over a pre-existing conditions issue based on the misinformation around it. I don't know how we're advantaged as a community by continuing to perpetuate misinformation. When we first tackled pre-existing conditions in a serious way, we did it together in this institution. I know because it was a gentleman from my state, Madam Speaker, Speaker Newt Gingrich, who was sitting in that chair at the time. It was 1996. Bill Clinton was sitting in the White House. Newt Gingrich was sitting here leading the United States House, and we came together, Republicans and Democrats. We passed the Health Insurance Portability and Accountability Act that abolished pre-existing condition worries for every single family with an ERISA-based plan. Those are the plans that the federal government controlled. So what I mean, Madam Speaker, is that for every single plan the federal government had dominion over, we eliminated pre-existing conditions. Medicare, no pre-existing conditions. Medicaid, no pre-existing conditions. ERISA plans, no pre-existing conditions. Collectively, that's about 250 million Americans. What we didn't do was go into the area where the federal government had no dominion, which were state-regulated plans. And we said states should have the ability to regulate their own plans. Now, President Obama said no, states have been moving too slow to help their constituency. He ran on the platform of taking those plans away from state control. He won that debate. The Affordable Care Act implemented those conditions, and the bill today says if states have an idea about how to protect families from pre-existing conditions that's better than the one in the Affordable Care Act, we don't want to hear it. There's one solution for pre-existing conditions, and it's the one that President Obama implemented, no other. I think that's wrong. I think that's wrong. Dr. Burgess knows more about medicine than I will ever hope to know. He knows more about serving patients than I will ever hope to know. Ms. Shalala, as Secretary of Health and Human Services, knows more about health care than I will ever hope to know. I trust these folks to solve solutions differently in Florida, differently in Texas than we do in Georgia. This bill does one thing and one thing only. It continues the debate from 1996, not about whether to help people with pre-existing conditions, but about whether states have anything to add to the discussion. I'm certain the state of Georgia does. I believe the state of Florida does. I know the state of Texas does. And if we defeat this rule and defeat this bill, we'll allow those very best ideas to come out, not ideas about how to keep people down, Madam Speaker, but ideas about how to lift families up. We've come together on those issues before, Madam Speaker. We can do it again. I yield.